Services to order. Today's October the 20th, 2020. First item is you have your agenda in front of you. Do I have a motion to approve the agenda?
I'll make that motion.
Motion made by Commissioner Crisco. Do I have a second?
Second.
Second by Commissioner Matheny. Any questions about the agenda? If not, how do you vote? Everybody in favor?
Aye.
Aye.
Any opposed? Okay, thank you. Motion passed. And do we have anybody to speak during the public forum of the Health and Human Services Board tonight? I don't see anybody different or extra, so we'll skip on down to the consent agenda. All we have on that is the approval of the minutes. To have a motion to approve.
So moved.
Motion by Commissioner Henson to approve. Do I have a second?
I'll second.
Second by Commissioner Crisco. All in favor?
Aye.
Any opposed? Okay, thank you. Consent agenda is approved. Now we move down to the Department of Social Services report. We'll ask Stephanie Smith, the director, to come and tell us what social services has been doing.
Okay. Well, good evening, Chair Robinson and Commissioners. It is early in the fiscal year, so there's not a whole lot of fiscal news. You had the monthly service report, so we reported August and September, and anything, if some of the numbers come in late, so if you see anything blue from July, it was because we didn't have it at that time. I wanted to point out a couple of things on our child welfare reports and adult services reports too. They have increased. They've begun to increase again. We've noticed that we're seeing more reports of domestic violence, not just substance use, and we probably anticipated that because of the fact that there's not been a whole lot of movement. People are in the same home for these extended periods of time with homeschooling and that kind of thing, virtual learning. So we have seen that increase. We do have, of course, the domestic violence shelter here and some assistance there, and we have a licensed professional counselor too that we try to link resources for those families, and of course sometimes it requires the child to be moved to another place. Reports, as I said, have started increasing. Our child welfare reports are already at 30 and we're halfway through the month, which is concerning. But we do know that we're going to start getting more reports as people start getting out, and we're getting a few reports from the schools and that kind of thing when they try to call and find a child or whatever. So we've noticed that. Also, at the end of the report, we try to give you a snapshot of what we're doing with nutrition services. And these are nutrition services provided by the Home and Community Care Block Grant. Our numbers are in the 120s for that. However, we had gotten to over 170 total because now we have Family First Caregiver Family First Coronavirus Relief Act money that's supposed to last until September, or if the emergency is lifted between now and then, they could pull the money. So we're putting out a lot more meals. They are still frozen. They are delivered weekly, and we run a couple of routes every day. We have just been verbally awarded some CARES Act money. Well, I should say they've approved our application. We applied for $55,702 for additional nutrition money. That will be for supplemental food boxes throughout the month. They're going to get an extra box. So that helps during the weekends when we deliver no meals. So we're going to get hearty soups and that kind of thing for them. And also holiday meals. That's always bothered me that we deliver the first part of the week, but then we're off several days, and some of these people are shut-ins that can't get out. So we are working with Food King to provide them a really nice hearty box with like what you would have a holiday meal, and it would cover 2 to 3 meals during that time. So they have approved our application, said it looked good. We sent the cost computation sheet. That's been verbally approved today, and they are saying that we will be able to order these meals in time for Christmas, and that date is November 11th. So we want to see it in writing. I said even if we don't have the contract, we want an email from them saying that we got it. We have gotten that approval on a Family First Care Coronavirus Relief Act. We also applied for this, $14,365. We're waiting on the contract now, so we are being awarded that money, and that's a little different. We applied for some money to take care of some primary caregivers that are not parents, like grandparents or aunts and uncles, who take care of children in their home because the parents are not available for whatever reason. And these people are struggling with virtual education, paying for, because they don't get any direct money for taking care of these children quite often, other than basic benefits. So this would go for their technology fees with the school and also their internet service so that they can help them along while they're in school, and that's through June. So we should be getting that money soon. I've already been talking to Mr. Grid a lot at the school system, and they have identified the family. So we're just waiting on the money so that we can start doing that, and that would help them because they do have a number of people they're having to do these incremental tech fees. So this would take care of that. And also, we think we can target 18 homes for however many children are in those homes. So that's what we're working on right now. Again, nutrition programs vary because we have had some to pass away. We've also had some individuals to be placed or to move in with families. And then they would say, we don't need the meals right now. So we have gradually increased those. Our in-home aid numbers are up. And so a lot going on in the in-home aid and the nutrition programs right now. Do you have any questions on the bi-monthly service report? Okay.
Have you started the level 1?
Yes,
in-home
we
aid?
have. Yes, we have. In fact, let me see if it's broken down. And we just got a new arms report. I don't know if it's broken down on here, and that is something we need to probably add. But yes, we do. Level 1, 2, and 3, but they're not broken out in what levels. I'll try to work on that, Commissioner.
I was just
Chairman
curious because I
Robinson.
know we had talked about
No,
it.
and we are, yes. We do not have any waiting lists, by the way. We work them fast. So, they're getting the services pretty fast.
So you have 1, 2, and 3?
Yes, we do. 1, 2, and 3, yes. So you have our performance requirements, our performance standards. That's the memorandum of understanding that y'all sign with the state to make sure we meet these or exceed these expectations. The new MOU draft came out last week. We've looked over it. They're moving some stuff around, basically the same requirements, but they are moving some of the 6 performance measures that are on the first sheet of those. Those are the performance measures for child welfare. Only one of those will remain on this MOU. The other 5 will go to Child and Family Services reviews, and those are when they come in and audit us. We are not going to stop reporting those to you. I mean, we need to stay on top of those. I'm very happy to say there was only 2. There was data not available on the last line of performance measures. Very happy to say there was only one thing we were shy of, and that was the expedited F&S apps. We are only, instead of 95%, we're at 94.78%. We did have a help desk ticket that kind of hindered us a little bit, and that is not our help desk. That is help desk at NC-FAS. Very proud of those numbers. Work First is going to be changing a little bit, and Some of the requirements they have right through the COVID, they're not requiring those, as some of y'all know. The requirement to work as much, they're not there. It's not there anymore because of the problem with getting jobs. But other than that, we are on target with everything. That is not something we can rest on our laurels tomorrow. We will continue to work. You have to work on it every day because every application, every call, every report is summarized in these MOU numbers. So, but we're very happy and there's committed staff working on this every day. I will get to you that MOU draft or the MOU, the final. There's been some talk on the listserv. Every year, there are counties that don't like it and they want to put a lot of attachments to it. We're going to meet these requirements. We're going to do our darndest or have a good reason why we don't. So we're not going to ask for any kind of attachment. Of course, we'll send this up to county admin and then to y'all, and you're going to have it well in advance. Unless they make major changes, you'll have that well in advance before the December meetings, before you have to approve and sign. But there's very little change because I went through it very carefully. Do y'all have any questions on the MOU and our standards, our measurements?
I just want to commend DSS on meeting these requirements as well as you have with all the COVID stuff going on.
Thank you. I'm really proud of that staff. I really am. They work really hard. They really do, really do. Very responsive. We do one thing about us. We don't want to be average. I hear all these DSSs complaining. Sometimes it's just, you just do your job, you do your very best, and remember that. Every one of these numbers, we know the people, we know the faces that go behind these numbers, and you can't ever forget about that. And the staff at DSS and Montgomery County do not. We deal with them, and I'm really proud. I'm really proud of those numbers. We've worked a lot. We've worked really hard on those and continue to do so.
Anybody have any other comments or questions? Okay.
All right. Thank y'all.
Thank you, Stephanie.
Thank you.
I think we have Mr. Nick with us, don't we? Isn't that him back there in the mask?
Yes, he is our new, now he's been a couple of months, our APS supervisor, adult services. He worked for us as a social worker, and now he's back.
Good to have you back. Okay, now we move on, I believe, to the health department.
Yes, I think we were going to recognize the sheriff. Unfortunately, we had a.
Oh, that's right. I'm sorry. Sorry about that, Chris. You should have waved at me.
Give a briefing.
We do have, we've had an outbreak at the sheriff's department of COVID, so he has some figures for us before Miss Mary comes up.
Thank you, Chris.
I think they've been working closely together on this.
Thank you.
We did want to, I did want to brief you as to what's going on in case you have any questions. 2 weeks ago on the October the 5th, we had a concern. That was the first time that we had a concern. We had 2 inmates. One was symptomatic and their healthcare provider felt like that they needed to be tested. The other was just close contact. It was their cellmate that was asymptomatic. And so those 2 tests were collected on October the 5th, Monday. Over the next couple of days, we had a couple of more inmates that became symptomatic and a couple of staff members that were, and we of course began isolating them away from the other inmate population or away from work if they were an employee. About 4 days later, Thursday, the 8th, we had the test results to come in, and the 2 initial inmates, one of them was negative and one was positive. But simultaneously, we had 2 staff members that had went home and sought help from their primary care provider, and they, of course, came in positive too. So we implemented on Thursday a lot of safety measures to include restricting inmate movement. We found that this was primarily, we have 4 pods in the jail. This was primarily affecting one of the pods. However, that pod is, of course, the larger of all the 4. We began restricting movement inside the facility, quarantining inmates and staff members who were symptomatic or were testing positive, providing PPE to all inmates and requiring them to wear them outside of their cell, and began aggressive cleaning and purchasing of a spraying device and using a chlorine-based chemical to disinfect the jail. We've done today maybe the 5th time in a 2-week period that we've done that. And of course, we notified the courts and informed them and ceased the transportation of inmates to and from the jail to the courthouse based on their request. So far, we moved into the following week. On October the 12th, we began mass testing. We tested the entire jail population of the staff and the inmates and the support staff. On October the 12th, we had 68 inmates, and when you put in together the staff and the support staff, that was 92 people tested. From those 92 tests that have trickled in over the last week, we have 62 negatives, 30 positives. Of the positives, it was 7 staff members, 23 inmates. One of the staff members, 5 were symptomatic and 2 asymptomatic. And of the inmates, it kind of reversed around. 5 that were symptomatic and 18 asymptomatic. So the inmate population, there were fewer of them that were having any signs and symptoms that were kind of shocked when we told them they tested positive. Whereas on the employee side, there were only 2 out of 7 that were in that scenario. The other 5 were sick at home. We had 1 inmate that was age 67 that was taken to Moore Regional Hospital and treated 5 days there, mainly fluids, respiratory care. He was returned back, discharged over the weekend and returned back to the center. Our biggest problem right now is we're turning the curve. However, we have about 7 staff members that are out. Either they're quarantined or they've come into this week. They tested negative last week, but came into this week and got a bug. And so their primary care provider yesterday and today, and so another test, and so they're isolated again through that process. So we're about 7 people short. 6 of those are COVID related, and 1's due to an emergency appendectomy. Today's jail population is 72, which is 63 males and 9 females. The good news is most of these people, particularly the inmates, only 1 was sick. The rest of them were very minor, if any, sickness at all. The bad news is staff. We're down to about 50% of staffing because of this, and so we'll continue to do what any institution can do, and that's monitor, test, clean, isolate, and reevaluate. Any questions?
Thank you, Chris.
Thank you.
Sure.
Thank you, Sheriff. Mary, I ask you to come forward and introduce your guest, please, ma'am.
I have Jody Carlson, she's our communicable disease program coordinator. She's going to talk about the other clusters in the county. And then the health advisory committee, part of them are here. Mr. Steve and Leanne and I'm sorry, Mr. D.
Hello. Let me start. Currently, the county has several open outbreaks or clusters. The way that things get defined by the state are outbreaks are within a congregate setting, and clusters are possibly in a workplace or a private setting, and that would require 5 cases for a cluster to be determined by the state. An outbreak would be 2 cases. So currently, our most current case is the jail, which Sheriff Watkins has already discussed, with 30 positive cases. And they have done their due diligence in regards to testing, have been extremely cooperative with providing the guidance in completing what we have asked them to do. Because many times people are resistant to have their inmates or their workers tested. But that's extremely important because when you have to cohort or segregate your inmates or your employees, you want your positive employees taking care of your positive inmates, your negative employees taking care of your negative inmates. So they are doing their due diligence. One of the other open outbreaks that we have is Southern Corrections. And they would have 6 inmates and 10 positive employees. They have not had a positive case reported to us in roughly 2 weeks. Another open outbreak would be Sandy Ridge Memory Care. What we have reported for them is 39 positive residents and 14 positive employees. At this point, they have not had a positive case reported to us since sometime in mid-September. What they did was, or what they're currently doing is, after an outbreak is started and you identify your negative cases and you identify your positive cases, positive cases are going to stay positive for an extended period. You know, we have found that people are staying positive 30 to 45 days with the surveillance we have completed, but someone could stay positive for roughly 90 days. So you'll never have to retest your positive people within that 90-day period, but you will need to continue to test their negative inmates, residents. And they are doing a rapid antigen test of their employees and a PCR test of their worker, or of their residents. So they're doing okay at this time. One of the other outbreaks would be Autumn Care of Biscoe. They had identified, or we had identified with them, 57 positive residents and 36 positive staff members, for a total of 93 positive cases. They are also doing a rapid antigen test of their negative cases, which they report to us weekly. And they have not had a positive since September. Another cluster that was identified was Eckerd Connects, and they had had 13 positive residents and 4 positive staff members. They have not had a positive case in a substantial amount of time, and their case will probably be closed. As for other employers, we had Klossner identified as a cluster with, but they have not had a positive case reported to us in quite some time, so they will be getting closed as well. And we also had McRae identified as a cluster as well. They had around 20 cases in the July timeframe and have not reported any other positive cases. And we had the private events, like a wedding, where there were many people who, 15, and we can only go by what is reported to us by people attending a party, but they'll be closed as well. Did you guys have any questions about clusters or outbreaks? And to be perfectly honest, very early on in COVID, they were not tracking clusters like they are now. And I think we've done a better job with following up with our COVID cases and asking them, you know, where do you work? Have you notified your employer? And following up with those patients and following up with their employer to know that they are not going to work sick, because many people would not normally disclose where they would work, or they would just report to work sick anyway. So we're definitely doing a better job monitoring it. And like I said, even though I have identified this is what is in our current workflow, but some of these cases are being closed out. But okay.
Thank you.
Thank you.
And excuse me, I miss Michelle, she's also on our Health Advisory Committee. So, good evening. So there is no budget summary because that's not been ready, but it's just recently approved. I did put a accounts receivable report in the packet, just more or less to show you what we're waiting to receive, what's due as far as bills are concerned. We billed 149 accounts 1st of August. Did we approve? Okay, sorry. Activity report was enclosed in your packet. The only significant highlights on there is, first of all, WIC. They've had a lot of active participants, 967 during this COVID. I think they're really responding well to not having to actually come into the building to receive their benefits. So because their participation rate was so high, they got a little extra money in WIC. Also, our care managers, their caseloads have been remaining pretty steady. CC4C has been at 62, and the OB care management has been at 68. Our maternity clinic, we've seen quite a few maternity patients. They were at 48 last month. Primary care, we've seen 18. Altogether, we had 150 clinic visits in September. Of course, we've had COVID. The number is down from August. In August, we had 262 positive. September, we had 88. Any questions about the activity report? Okay, I think you all reviewed the policy manual. I see that on the agenda here. There are several policies in the procedure manual that need to be reviewed and signed. You can go by that. Okay. So, old business, let me back up. The SOTS report was included in your packet. Have you all had a chance to review that? If you notice that the same concerns that we had last year, the same concerns that we pretty much had again in this report. We still had substance abuse, prevention and reducing in opioid, alcohol, and tobacco abuse, diabetes and obesity, and then teen pregnancy prevention. They're still the top 3 in the county. The one good thing in the report is that the high school graduation rate 2018 to 2019 in Montgomery County was 90.9%, which was higher than the overall state of North Carolina, and I thought that was good. Any questions on the SOX report?
Anybody have any questions?
Okay. All right. So, partially due to COVID and some other funding, we have gotten some funding that needs to be approved by the board tonight. The first one was enhancing COVID detection. It's for $119,000, $119,245. Some of the guidance on what we could do with it is to improve our contact tracing and data entry into CCTO. Excuse me. So at any rate, we are contracting 2 staff members from On Target who does our preparedness. This will allow our 3 case managers to go back to working on their programs because we've been using them a lot for this. We also want to enhance the health department's ability to participate in group webinars and training by having a conference phone and a camera set up in our kitchen/conference room. And then we're looking at purchasing HEPA air purifier systems for each exam room. Excuse me, for each exam room. These HEPA filters will remove 99.99% of airborne contaminants down to 0.1 microns, including allergens and aerosolized viruses from a room. We also plan to do outreach for COVID in each township. Class is the other one for $25,000. It is to make sure we are providing culturally and linguistically appropriate services. It's about respect and responsiveness, respect the whole individual and respond to the individual's health needs and preferences. The health inequities in our nation are well documented. Providing class is one strategy to help eliminate health inequities by tailoring services to an individual's culture and language preferences. Health professionals can help bring about positive health outcomes for diverse populations. The provision of health services that are respectful of and responsive to the health beliefs and practices and needs of diverse patients can help close the gap in health outcomes. The pursuit of health equity must remain at the forefront of our efforts. We must always remember that dignity and quality of care are rights of all and not the privilege of a few. The next grant is maternal health innovation. It was for $7,500. It is to be used to promote and implement innovations in maternal health services, delivery of service by improving access to maternal care services and supporting postpartum and interconception care using telehealth. And interconception care is the care that's provided to mothers between pregnancies to improve health outcomes for women, newborns, and children. It includes interventions that modify risk factors in order to promote healthy outcomes for future pregnancies. So the agreement addenda says that we can provide gift cards to maternity patients as incentives to keep appointments, and also purchase 2 laptops for telehealth. The next grant is infant mortality. It's for $2,406, and it's to be used to enhance the ability to provide training to expecting and new moms, particularly our safe sleep classes, which we in the past were doing face-to-face, but because of COVID, we haven't been able to do that, as well as breastfeeding classes. We would like to purchase $120 webcam, $150 Zoom membership so that we can provide these classes, and then use the rest for advertising and continuing education for the staff. And lastly, we have the COVID-19 infection prevention grant, $50,144. And we were looking at providing education to the Hispanic community because they had such a high rate of infection, but that has changed in the last few months. So we just want to provide education in various townships to the people in the different townships on how to prevent COVID and to protect themselves. That is all. Any questions? No?
Do you need approval on those grants?
Yes.
Matthew, can we take them all in one?
Yes.
Do I have a motion to approve those grants that Mary just presented?
So moved.
Motion by Commissioner Henson. Do I have a second?
I'll second.
Second by Commissioner Crisco. All in favor?
No.
Any opposed? Okay, thank you.
Okay, thank you.
Mary, I had an inquiry this week about the Laotian community.
Mm-hmm.
Has there been any problems with COVID? Or are we
We've
doing
had
any
a
outreach there?
Few cases, but we will go wherever they will allow us to come in to do an outreach. But we've had very few cases in that community.
Well, this was from somebody that used to live here, but they're out of town, and they asked me if I knew if there'd been any outbreaks out there, or if they
Well,
were.
not major outbreaks. We've had some cases, though,
Okay,
yeah.
thank you.
So, a couple of weeks ago, the Montgomery County positivity rate was at 7.5%. We thought we were doing pretty good because we were moving toward that 5% that the state wants. But now it's at 11.3%, so it's creeping back up. I think I spoke with you all the last time we met about OptumServe. They are the contracted agency that is coming in to do testing in the county, free testing. So they were over in Candor. They started last Wednesday. And unfortunately, they've not had a good turnout. I think they did 3 Wednesday, 4 on Thursday, and maybe 5 on Friday. So I spoke with one of the persons that's been my contact with them and suggested that we move it to the agricultural center and see if we can get more people to come and get tested. It's free testing. So Robbie is working on that. Robbie Smith is working on that to see if it's available. And their plan is to provide the free testing through the end of November. So we really don't want to miss this opportunity. It's a good opportunity.
Okay.
Let's see. I think that's all I have. Any questions?
In regard, if you don't mind, in regard to the Laotian community, I have done some outreach myself because I have a presence in that community. And my godchildren speak both languages, and so I have tried to do some education as a representative of the health department on my own.
Okay, thank you.
You're welcome.
Thank you.
Madam Chairman, I was going to suggest if we wanted to go around the room to the members of the Health Advisory Board and see if they have any questions or comments.
If they got any more comments.
Yeah, if any of the members of the Health Advisory Board want to ask any questions to Mary or staff.
Does anyone from the Health Advisory Board have any questions for the staff, for Mary's staff, or for Mary? Michelle, John, Karen, and
Does the Montgomery County website, and I haven't looked today, is it up to date now?
He just did it today. The map is not, I don't think the map is ready. It is on there? Okay. But he did it this afternoon. So the what I handed out is up to date, as of today. It'll change tomorrow.
So we are updating it daily?
No, we're not. Because the test results come in so fast, I mean, he would be there every hour just about, trying to keep it updated.
Do you know when the last time it was updated before today?
I don't think we did it last week. We did not do it last week. I know that the state website has it on there, but they're always behind us. Their numbers are never exactly matching ours, so they're always a little slow.
Is there a plan to maybe do it weekly, just so the rest of us that are working with COVID and reporting to, the state, could we possibly have, like, by the end of Friday, we'll know that it's up to date for the week?
We can try, but we get a little overwhelmed sometimes. Because there's a lot when you're getting positive tests and you're getting them in 10, 20 at a time, and somebody's got to call and
Oh, you're speaking
enter
my
data.
language. I
You understand?
understand.
So sometimes that kind of gets left out, but we'll work on that. And I've also talked to Mr. Helms about trying to get the sites together so they work a little better. So I think they may have something on the front side and it's not on the health department side. So I think Kyle's working with him on that as well. I did have one more thing. The COVID-19 vaccine, the state has reached out to us about that. And we had to fill out a form saying that we wanted to be a provider. And from a call that I was on this afternoon, it was shared that Walgreens and CVS have been contracted to take care of the nursing homes, all the nursing homes. So we'll see how that goes. Still don't know when it's coming, but it's in the process.
Madam
Yes,
Chair,
sir.
A couple of things. One, I would agree that I think that more priority needs to be put on the website and keeping that up to date, at
Okay.
least weekly. Like I said, it's been running 2 or 3 weeks late.
Okay. We'll work on it.
And two is the availability of the flu vaccine.
That's the other thing. We haven't got ours in yet. We're still waiting. They told us it would be here by mid-October, our vendor did, and we're still waiting for it.
Do they just push that to the health department, or do we order it?
I think we kind of get pushed to the end with all the bigger companies like Walmart, CVS, and Walgreens. They're getting theirs faster than we are.
Are we getting well past the time that people should have gotten the vaccinations?
Will that be put on the website when that's available?
Yes, we will. And I know that a lot of county employees get the vaccine from the health department, so we'll definitely let human resources know when we have it in as well. Yeah. Any more questions?
Anything else?
We haven't seen any flu cases being reported yet, have we?
Haven't seen any flu, well, not in our county, but I know there was one flu death in North Carolina. That was on the 15th of October. Okay,
Is that it?
yes,
Thank you, Mary.
okay, thank you.
Thank you.
Thank you.
You want to have anything else for the Consolidated Board? We appreciate the Health Advisory Board coming tonight. Mr. Wood, did you have anything else for this board?
No, ma'am. Thank you.
Okay, then I declare this meeting adjourned.